As you may know, interest in this topic has exploded in the past 10 to 15 years. So it's very timely to present this information. It seems a simple question. For example, who has more pain, men or women? But we will talk about qualitative and quantitative differences. And so those factors are important to consider, and the many mechanisms that may contribute to gender differences in pain may have important treatment implications.
In terms of the quantitative differences, that would have to do with the fact that for most pain conditions, most chronic pain conditions, females have a higher prevalence than males. It's not true for all of them necessarily. But to me, more interesting is the qualitative differences, which are the aspects of their pain condition in which men and women differ, which are much more likely to have treatment implications. Things like the way they cope with pain, the emotional response, or even thoughts related to their pain condition. We're interested in the mechanisms through which males and females would differ in their pain conditions, and we subscribe to a biopsychosocial model acknowledging there's biological differences, things like hormone levels, response to medication. But because I'm a psychologist, I'm equally or maybe even more interested in the psychosocial aspects of the differences between men and women in terms of the way they relate to their pain condition or even experience their pain condition. For example, we find that in males, the relationship between anxiety and pain is much stronger than it is in females. Conversely, the relationship between pain and depression is stronger in females. In terms of an important coping strategy difference, there is a negative, emotional focused coping strategy that is more common in females. We call it catastrophizing. And so these patients they're afraid of their pain, they're afraid it's never going to go away, they sort of amplify it in terms of their thoughts. So it's sort of a negative cognitive coping strategy. And we also find that it's more related to their pain condition for females and males, and there's some studies that even show that it has treatment implications.
So there are many mechanisms that could mediate sex and gender differences in pain. In terms of the biopsychosocial model, the bio or biological part is of particular interest to many researchers and clinicians. The most obvious biological mechanism that people think about is sex hormones, particularly estrogen, but certainly other hormones like testosterone may play a role. It's clear that these hormones do influence pain, but their relationships with pain are quite complex. But hormones are not the only biological mechanisms that we want to think about. There is evidence that there are sex differences in the functioning of the endogenous opioid system. So the ability to engage the opioid system to control pain may differ for women and men. Also, genetic factors seem to influence pain differently in women and in men, which has implications for future use of genetics in personalized medicine. For example, if a particular gene only matters for pain or pain treatment in women, then testing that gene in men to predict treatment outcome is not going to be an effective strategy. So there are a lot of biological mechanisms that are contributing to sex and gender differences in pain. So in terms of responses to pain treatment, there is some evidence that men and women may respond differently to pain-relieving medications. Obviously, that's very important to know, because if we're needing to tailor our treatment based on the sex of the patient, that information needs to be available to clinicians on the front line. At this point, we don't have enough information to tailor treatment specifically for women versus men, but there is some evidence that both the pain-relieving effects as well as the side effects of opioids seem to be somewhat stronger in women than in men. We don't know as much about other medications. So one outcome of thinking about this is that we need more research on sex differences and responses to medications.
The most common one used is a 3 to 4 week multidisciplinary treatment that involves things like cognitive behavioral therapy, physical therapy, and medical management. Unfortunately, there's a very limited number of studies which have actually tested for sex differences. Some of the studies were random trials, whereas others were just data from pain clinics, although I'm sure that they included appropriate inclusion and exclusion criteria. What's really not clear is, even in these studies, to what extent men and women actually receive the exact same treatment. Because of the fact we know that men and women differ in the way they experience pain, it's very likely that even in these programs, pain treatment is tailored to this particular individual.